Hi guys. I just wanted to go over the Lancet article that I mentioned a couple days ago. And I actually did several takes on this because I tend to go in too much into the detail. So I wanted to make it simple and just getting to the point. So I'll just go over this and then and just today's video is going to be pretty short. So anyways, let me do a screen share so they can actually see what I have. Let's see if I do the entire screen. So you're just looking at my Lancet article. This is where I wanted to talk about and focus on the actual figure, but let me just introduce you to the article first. So this article was actually uh, published on March 11th. So, so it's relatively recent. It was written by uh, physicians in Wuhan, China, in the wave of the hospital um, saturation by a bunch of patients. So they had lots of patients there. And then basically they assessed the outcome and also the progression of the symptoms. So let me actually show you where I want to get to. Basically, I just wanted to tell you that it was done done on number of patients. Total number is 191, and part of the, some people survived, about 137, and then 54 people didn't make it. So it's quite significant numbers. Again, this is still early cases until about, I think, end of January. I think I have to actually look. There, I just circled a couple like the abbreviation stuff. But anyways, just going to getting to the point. So you can download this article in PDF form, which I did. So again, you can just download this and you can actually look at the actual article if you want. And I'm going to put the link up on the or down here on the description. But basically, what's interesting that, and you can look at what type of symptoms, how many days in the table, but there's a pretty good visual description here. So let me actually make it slightly bigger so they can see it a little bit easier. So now, basically, so it's a comparison between survivors and non-survivors. And basically, they are, they're not 1-to-1 ratio in terms of numbers. There are more survivors, but this is just looking at the numbers as an aggregate. And also it's so they are spread between, if although let's say the symptom starts out from day 1 through day 7, and then around day 7, cough starts, continues. Right around day 7, you can start having difficulty breathing. So from day 1 through day 6, you have these symptoms. And then difficulty breathing starts happening right around here. So from day 7 through day 12 and so on. So, but again, they are the symptom, the days ranges, but on median value, it's roughly about how this appears. So just so that and that there are significant numbers of people. So I think on average, this is how typical symptom progresses. But anyway, so fever, cough. So between survivors and non-survivors, fever and cough stays right around the same. So day 1 through day 6. So having fever, coughing continues, and then right around day 7, and then you're going to start having difficulty breathing. What's interesting here is that the symptom onset of the symptom is pretty much identical for both survivors and non-survivors. And then progression of this difficulty breathing continues, and then eventually the patients would be admitted to ICU. So, but along the way, the patients get admitted to the hospital and then experience around sepsis right around day 9 and this case day 10 for non-surviving patients, and then surviving patients day 9. But just looking at median values and how much the spread, the sepsis happens right around the same time, and then and ARDS, the acute respiratory distress syndrome occurs right around the same time, day 12 and day 10 through day 12. So they don't really have a whole lot of difference in terms of how the symptom progresses, and then ICU being admitted right around day 12, and then because of sepsis, and then eventually it's going into real respiratory issues. But anyways, the difference is that the right around day 14, the invasive ventilation was needed. So, and for surviving patients, they don't have that, and just being in ICU, and then eventually the patients will come out surviving, and throughout the entire process, they used SARS-CoV-2 as a indicator for virus, but it's the same. It's the same as COVID-19. Just the way the WHO named this virus. This one, this article, people just call it SARS-CoV-2. Anyways, so, but the entire time the virus was detectable all the way up to day 12, until the discharge took place after 2 consecutive days of not having the positive indication for presumably PCR. But anyways, so there's no virus, and then the person is discharged. Doesn't happen to the patients who didn't make it, because right around day 9, the death takes place. But anyways, the point is that it's pretty much the progression of the symptom is pretty much the same, except that people who didn't make it starts developing more severe symptoms up until this point, that where they were patients are patient required more invasive treatment, things like ECMO, like drawing the blood, reoxygenate, and then put it back, type of invasive oxygenation, because of the amount of O2 in the blood is so low, and then during that time, from the ARDS, you already have a lot of the systemic problem starting from sepsis anyway. So starts developing lots of other symptoms, which leading into the systemic failure of the organs, and then basically after several days the patients don't make it. Again, so it sounds scary, and you would probably think this is like like you wouldn't know what's going to happen. There are a couple of indicators that was described in this article. So there are certain risk factors, like whether you're a smoker, and there are some statistical studies, statistical analysis on type of the groups of people who are at higher risk of dying. But anyways, I probably won't go into it right now, because I said this video is short. My point is that, and this is the important part, the progression of the disease is pretty much the same whether you would make it or you don't. And I know you would feel scared if you know that there's a possibility of death. But what's important here is that, again, you won't really develop really bad issue until you're having difficulty breathing, which is around day 8. So, which means, and then you have sepsis. But anyways, the point is that you won't really have any systemic issues until about day 8. So you will have fevers and coughs, either cases. But when you only have fever and cough, there's nothing much the hospital can do for you because your symptom is really not there to call for the intensive care unit. So it's hugely important that you, and this is the important part. It's hugely important that you wait until your symptom becomes more severe to get medical help. And part of the reasons why China or Italy went completely in chaos in terms of medical care was because the patients who were afraid that they were being infected just overwhelmed and saturated the medical care system. So you will have time to start developing actual symptoms, severe symptoms, before even you start developing a difficulty breathing. So which is right here, difficulty breathing. You have about 5 days. So when your nose is running, or when you are, when you have a cough, and I know you want to be tested, and you probably don't want to get tested, just because again, you can watch the video. I made a video about the polymerase chain reaction PCR test being it's a good indicator to prevent spread of the disease, but you don't want to again overwhelm, and you don't want to use that to make sure that you are infected or not, because there's a lot of false positive there anyways. So so the best thing you can do for the community is to wait for your symptom to actually become severe, so that when you have day 1 and day 2, you could very well have just a common cold. You don't know that. But when you go to the hospital, when you try to get help, and if you really need get help, and I suggest that you do, and I think you should get help when you feel that you need it. But when you have a common cold, and just because you want to get treated, there's nothing much the hospital or clinic can do for the common cold anyways. And that symptom continues for about 5 days anyways, on average. And then you're going to have difficulty breathing, but you still have time before when you have difficulty breathing. And that's when you probably should have the PCR exam. Until then, you probably want to get isolated during this time, because one thing that can happen when you start trying to get help when your symptom is mild is that you're going to overwhelm the medical care facilities. And then the people who really, really, really need to get help can't have access to that medical help that they actually need. So keep that in mind. Hopefully, again, this only, again, mortality rate is not 100% for this particular virus. In fact, there's a huge chance you will just make it alive, but of course you don't want to spread your disease either. So in this case, you want to make sure that you want to isolate yourself, and you stay home until you feel that you need a medical attention. So again, please, just be mindful that the hospitals can't really do a whole lot until you really have a severe symptom. In this case, difficulty breathing. And then at that point, instead of going to the hospital directly, contact local local healthcare advisors, or call in the clinic or call in the hospital ahead of time, or ask to appropriate agency to where to go to get help, so that you wouldn't infect others in case you're being infected. So again, so thank you for watching. It sounds kind of harsh, and I didn't know how to present this because I thought about this a lot. Sounds scary. But again, I tell you, I mean, it's easy for me to say not to be scared. I feel pretty optimistic because again, everybody right now is staying, inside, and they are trying to minimize the social exposure to outside environment anyways, and which is a very good sign. And let's keep it this way, and then hopefully, we can uh, if we wait if we can just withstand this for 2 to 3 more weeks, and that sounds like a lot, but then this will subside and this will not go out of control. And I will show you the reason why I think so. So, and actually I have another video coming up either today or tomorrow. Um, and then that also still looks encouraging. So anyways, so thanks for watching. Again, please spread the word. Just tell people that the symptom is going to, well, I mean, you don't want to marginalize. So, you don't want to say like, either you die or live. Either way, it's going to be the same. You will have time to get help. And then as long as you don't overwhelm and saturate the medical care system, we have a much larger chance of survival. So let's keep it this way. And I think we can do this. So again, thanks for watching and spread the words. And then and I'll keep you posted again tomorrow for new information. Thank you very much for watching, and I'll see you soon.